Hey everybody, Dr. Tammy here. Happy Saturday to you. I just want to do a quick little video. The post that I put up on natural versus synthetic thyroid, I got so many responses and that was great. And I just love your dialogue. Whatever you guys write, there's really no right or wrong answers, but I just want to give you my perspective, why I think one or the other, so that you can make your own informed decisions, because I think that you get so much misinformation from the medical community, and I am a medical doctor, so I've been there and I know what all that pressure is. Synthroid or synthetic thyroid is a multi-billion-dollar industry. You know, it's like, I think the quotes was like 20 million prescriptions a year. It's huge in the US. So a lot of people who come to my practice have thyroid issues, and I'm not even going to go into a whole thyroid discussion today, but I just want to talk about the difference between synthetic and what we call natural thyroid, just to kind of put that to rest just a little bit. So what is the reason that some doctors may want you to be on Synthroid? Well, there is a lot of push from the pharmaceutical companies, but there's also a lot of misinformation that's come out. So I want to just kind of clarify what is synthetic and what is natural thyroid. So synthetic implies that there's something not real about it, right? Kind of like synthetic eyelashes or synthetic fingernails. And it is actually, as far as thyroid goes, synthetic is actually bioidentical thyroid, right? So it's not like they've altered it. It is produced and made in like the laboratory, but it is bioidentical, meaning that it is exactly what your thyroid makes. Natural is actually from an animal, not made in a laboratory, but from an animal, and usually it's from a pig. So they take a pig thyroid because it's most similar in structure, which is also bioidentical to us, and then they formulate that. So what's wrong with synthetic? Well, nothing's really wrong with the synthetic, and lots of people do really well on the synthetic and do just fine. But here's the problem. So I want to kind of draw this out for you just a little bit, and of course I have to draw a little person here because that's kind of what I like to do. So anyway, we have this little gland in the head called the pituitary, and then we have the actual thyroid gland. So the pituitary hormone makes a hormone called TSH, which is thyroid stimulating hormone, and then the thyroid gland actually makes something called T4, which gets converted to T3. And that's called T4 because it has 4 iodine molecules on it, and there's a deiodinase enzyme that pulls that off and makes T3, which only has 1 iodine molecule on it. So why am I telling you that? Because synthetic, synthroid, let's just say synthroid, is only T4. The problem with that is T4 is the inactive thyroid hormone. So when you take that, if you have a problem converting to the active form, then you don't feel very good. You don't have your metabolism, you don't have all the things that T3 does. So the beautiful thing about natural, or what we call, there's a couple different forms. You might have heard of Armour thyroid, you might have heard of MP thyroid, Nature-throid, West-throid, a bunch of different preparations. Synthetic is also called Synthroid, also called levothyroxine. And some of these generics are dirt cheap, like on the $4 plan at Walmart. So, you know, that's one reason, is if you do well and you convert, then that's a good reason to take Synthroid. And I have some patients who do just fine on that. But if you don't convert, something's wrong with the enzymes here, you have an autoimmune condition that's affecting your conversion, then you need T3. So the beautiful thing about these natural preparations are they are just desiccated or ground up thyroid, and so you get both T4 and T3. But not only do you get T4 and T3, which T3 is the active, you also get T1 and T2, which are other kind of brain-converted and tissue-converted thyroid hormone, and you also get something called calcitonin. And calcitonin is a hormone that works with the parathyroid glands, these little glands on the side here, to put calcium in your bone. So why do you need that? Well, if you don't put calcium in the bone, then calcium goes in the blood vessels and can cause heart attacks. Calcium can go in the breast and cause breast cancer. So all sorts of different issues with that. Calcium can accumulate in the thyroid gland and cause thyroid cancer. So calcitonin is very important. So if you've had your thyroid radiated, like you had cancer or you've had really bad Graves' disease and they radiated it, and you have no thyroid tissue left out and you have to take thyroid, then just T4 is just one hormone. And you're not getting T3, which is the active, and then you're not getting all these other guys, which you may need. And so instantly people usually feel better, especially if they've had autoimmune or ablation when they take this. So that's a good reason to take these. And if you don't have any problem with autoimmune thyroid and you just have a low T4, Synthroid may be a good option for you. Now, one of the things that the doctors, the traditional doctors, say is that Synthroid, what they can do is they can track the TSH levels, because when this level goes up, this level should go down. So if they give you this, then this should respond appropriately. And so all they have to do is check one lab test and they can tell you you're fine. But if you're checking a TSH and you're taking Synthroid and you're still gaining weight, you're still constipated, your nails are still breaking, your eyebrows are like 1/3 of your eyebrows are gone, your skin is dry, you're tired, then you're probably not converting. So that's a good reason to ask a doctor for a full panel. I usually recommend the T4, the T3 total and free, and then the autoimmune thyroid panel, because if you're not converting, that's a problem. You can look for antibodies against these enzymes here. You can do something called a reverse T3 to see if you're converting back and forth. So all sorts of different things you can do there to test and see if you actually need this. So it's kind of like with bioidentical hormones, you know, it's not just estrogen that a woman needs after menopause or after hysterectomy. It's progesterone, it's testosterone, it's DHEA, it's all those other hormones. Same thing with thyroid. Now, the traditional medical doctors have been trained, and I was trained this way too, all this fear-based business of medicine trying to push these, you know, pharmaceuticals, that there is some regulation issue, that Armour thyroid, number one of the arguments you'll hear is that because it's pig thyroid, that there's like a version of mad cow disease that can happen. So that's just crap, because we eat pork all the time, so that's not even a good argument. The other argument is that the FDA doesn't regulate it. That's not true either. They regulate it just like all other pharmaceuticals. You can get Armour thyroid or MP thyroid or any of these at a traditional pharmacy. So that's not true either. Now, you can get compounded thyroid at a compounding pharmacy, and I love to do that. It's a little more sophisticated and a little more expensive, but you can actually get T4 and T3 compounded, and so we can give you the exact dose that you need. So that's really fun, and I like to do that. Or we can just give you T3, which is the active form. I think of this like a little Ferrari, and this like a little red bicycle, and this like a little red Ferrari. So you want your Ferraris, right? Or my husband likes Lamborghini, so you like the fast cars. You want the fast T3. That's the big deal. But you know, you can. There's, you know, sometimes you can use some of these other things and they're okay. There is a synthetic T3 that you can use as well. So you can use T4 and T3 here. So it doesn't necessarily mean that these synthetics are bad. So I use those, and I use those in some patients, and there are cheaper versions sometimes. This is probably the most expensive way to go. I love this one because it's natural, but you know, if you can be looking at sometimes $70 to $80 a month for your thyroid, and some people can't afford that. So, and a lot of times just going with this is all people need, and they feel really good. So, you know, as far as some of the arguments about some of the recalls and stuff, Synthroid has actually been recalled more than probably any other medication on the market for consistency and different issues they've had. Armour's been pretty much unscathed. So you can do your research and look all that up, and you know, make sure that what I'm telling you is true. But hope this helps that argument just a little bit and clears some things up for you. So love to help you. If you want help with your thyroid, I look at thyroid very differently. So people who are sluggish or have symptoms but they have borderline low thyroid, I do believe in treating that. I also believe in the thyroid temperature syndrome. So people with low temperature, low body temp, you have to have heat to burn calories. So if you're gaining weight and you're sluggish, that's a good reason to look at this just a little differently. So I like to talk with my patients. I like to see what the best fit is for them and look at levels, and not just a TSH, but do the whole panel. So that's really important. So hope this was helpful. Love y'all. Please have a blessed weekend. And I know I also did another little post on artificial sweeteners, so I'm going to do that tomorrow. So stay tuned for that. So many exciting things. Please share this video, especially if you know someone on thyroid medication. This can be really helpful for them. And once they understand things, it can empower them to take a little bit more charge of their healthcare and that approach. So that's great. So please share this video, share the crap out of it. Please comment, like it. Please share everything. I'm going to put some longer versions on YouTube soon. So I'll give you even more information, but I want to keep this brief. All right. See y'all tomorrow. Bye-bye.